Hi everyone, welcome to today's cross-theme seminar. Today we've got 3 presentations, one from Daniel, one from Amanda and one from Andy. So presentations are 12 minutes followed by 3 minutes of questions. So first up we've got Daniel.
Oh, hi everyone. I'm going to tell you today about a bit of ongoing work to try and identify cross-country differences in the effect of unemployment on health and well-being. Now, in a lot of the work that we do in our little group, it's trying to find out ways of minimising the negative impact of some economic determinants of health. So unemployment is one of the major ones that we focus on, and we're always interested in how welfare state policies, so policies that aren't directly intended to impact on health, can actually influence this relationship. So in particular, if you were fearing unemployment, if there was a greater safety net, would that reduce the impact of on your mental health of that fear, that sort of thing. Now here, I'm particularly interested in welfare state expenditures. So you have a lot of research that looks at the type of welfare state, and I'll go on to that in a second, but there's very little on the actual expenditures of the welfare state. So that could be benefit generosity, it could be employment policies, active labour market policies that look to give people the skills to minimise their time in unemployment, so they transition very quickly, so you have a smaller health effect. But I think that's okay. But since welfare state expenditures change in a very limited extent within countries, cross-country analysis is needed. So we need comparable data across multiple countries, and then you can compare different expenditures between countries, as well as the relatively limited change in expenditures within a country. So that is what I attempted to do here. Now, the expenditure focus, many of you will have seen analyses that have welfare state types, and this is based upon, a very influential paper. But those types now, I mean, the extent to which they're true is debatable, certainly. Welfare states do change over time, and the expenditure approach may allow us to look at how these changes over time have impacted on health and well-being. And then I try to value this using 2 different tools from health economics, so we get to a monetary value for these transitions. But just to show you a little bit of that, there is still some variation within countries. So here we have 3 of the countries that I look at. We have Australia, Germany, and the UK. On the left-hand side, you have active labour market policies. So these are the policies that I mentioned, things like lifelong learning, employment support, particular training, all these sorts of things, where you try to keep people or get people into jobs. And on the right-hand side, you have the passive labour market policies. And this is basically unemployment benefits. It's just when you give people money as they become unemployed. Now, the most interesting one is the red one. So this is Germany. So you can see that both since 2000, as a percentage of GDP, there's been a great shrinking of the welfare state in Germany. Now, Germany is one of these welfare state types that's held up as a typical model. And you can see that that type has now changed because of the reforms that you've had there. And then if you just look at the very striking blue dot at the end, this is Australia, right before COVID, unfortunately. but they introduced a great expansion in active labour market policies. So this was an employment support programme, but of course, then it was very difficult to actually get people in employment once COVID came. But you do get some changes, but they're fairly limited. So trying to look at the differences between countries might take us a little bit further. So I have 3 research questions, and the first one is just, are there differences between countries in the health and well-being effect of unemployment? And then we go on to the monetary evaluation of those. And then the final question is, do specific welfare state expenditures influence that relationship? That's what I'm looking to do here. Now, one thing that's held back cross-country comparative analysis is that there's not necessarily been data sets available that allow us to do this. So this is an amazing resource, the comparative panel file, that brings together the household panel surveys. So things like Understanding Society, PSID in the US, HILDA in Australia. It brings them together and puts them in some sort of comparable form. So you have 7 countries available, and this it makes this cross-country comparative analysis much simpler, but not easy. This is status syntax, it's quite complex. As soon as you try and add a variable, it becomes very difficult, but it is still a great resource that allows us to take a step forward again. And the way you have to do a lot of the work yourself. You have to get all the data sets that you want from the particular authority that distributes those, and then run all the syntax and modify it your own way. So what I do, these are individual fixed effects models. They're country specific to start with, to do the comparisons between countries, and then I pool them so that we can look at the expenditures. I use 6 countries, so Australia, South Korea, the US, Switzerland, Germany, and the UK. And I have a period from 2001 to 2019. Only the working age population am I interested in here, and those that are employed or unemployed. So the other labour market states I'm not necessarily interested in. Well, maybe I'm not interested in them for this project. And then here I split by gender, because in a lot of existing evidence, okay? In a lot of existing evidence, there's great differences between male and female in the effect. So these are the exposures. It's the specific transitions from employed in one period to unemployed in the next. And I do this for all the combinations. And so there's a mixture here. So some people, when you're starting to talk about causal effects, economists in particular would start to say, oh, some of that is voluntary unemployment. So it is a mixture here of voluntary and involuntary. But I imagine that most of the people haven't chosen to become unemployed, but there is a slight limitation there. And then later on, I interact those with the expenditures. So two outcomes. One is life satisfaction. So this is our well-being outcome. And this allows us to convert to something called a well-being year, where each 1 point change in that life satisfaction score is worth, in the UK, £13,000 approximately. So these figures come from the UK government, the Treasury guidance on how to value these health outcomes within evaluations. And then health-related quality of life is a more established measure. So these are the QALYs, and 1 full year in perfect health is worth about £70,000. Now, later on, there's going to be quite a big difference in the valuation of the outcome, depending on which one of these that you use. But they're actually the valuations are generated one from the other. So you might want to keep at that. Confounders, just a lot of the things that you would imagine would be there. Right, so then some results. So here we have the country differences. for the well-being years for the males. If you just look at that top line, you see that there are differences between the countries in the effect of transitioning to unemployment. But despite there being different welfare state types within the European countries, the three yellow ones at the end, there's actually not a great deal of difference in the effect. So despite differences in welfare state type, the effect of unemployment of that transition on well-being is still negative, it's still large, it's still larger than the other countries that aren't in the European region. But there are some gender differences that you only really observe in the UK. So here I've just gone down to Australia, Germany, and the UK, and this is for the quality adjusted life years. So the reason I've only got 3 countries here is they're the only 3 with the information to allow me to measure QALYs. And yeah, you see that the impact of transitioning to unemployment for males in the UK is worse than the effect for females, but we don't see that in the other countries. Now, here we go on to this monetary evaluation. So whether you're using a QALY or whether you're using a Wellbeing, the effect of that transition is the valuation of that transition is about 5 times more, about 4 or 5 times more if you use the Wellbeing rather than the QALY. So if you look at that first line, this is the effect of the transition for males in the UK. If you use the QALY valuation, each transition is worth just over 2,000, whereas if you use the Wellbeing based measure, we're up at 10,000. So it really is going to make a big difference to your economic evaluation. Then policy expenditures, this is where it gets tricky. So for the when I do this for the well-being measure, we start to get quite unusual things that actually spending makes well-being worse. And that, I think, is because there are still challenges with using expenditure-based measures. So this is only for the passive policies. The active policies make far more sense in that they're positive, that spending is a thing that limits the effect of these transitions. But I think this is actually because the passive policies, they increase in times of recession. So I need to start to express this as a ratio of the employment rate. And I think once I do that, we might get something a bit more sensible. But these are unstable. It's still very challenging to work with expenditure data. And yeah, so just to sum up, so we have that employment is always damaging for health and well-being in any country, any welfare state context that I've looked at. But there are still some cross-country differences, particularly in terms of gender effects. And either whether you're using QALYs or you're using Wellbeings, there's substantial social benefit from preventing these transitions. But finding out the specific expenditures that are needed to achieve these benefits is still quite a challenging thing, and that's ongoing work. So that's all. Thank you. How long do we have for questions?
3 minutes.
Oh, thank you. It's very interesting. I just wondered why you've chosen those 6 countries. And one reason I was asking that is because I was wondering if the experience of being unemployed and having to charity, I guess, or claim money from the welfare state might be different between different cultural contexts, for example.
Yeah. So the reason why is because they are the data sets, household panel data sets that are available. So this comparative panel file that I use, that has only 7 countries available. The country that I exclude here is Russia. And the reason why is because their panel data isn't really a panel. You might have some people that are the same, but there's a lot more variation. When I do include Russia, they're extremely unhappy. The results are much larger for that country compared to the others, but the data is a bit different, so it's not necessarily comparable. But your point about social context is spot on, because this is why we think there are gender differences in different countries, because of the social norm of particularly of men being expected to be in full-time employment, and that's often the explanation given for gender differences in unemployment transitions, because you don't necessarily see them in well, we didn't see them there in Australia and Germany, and historically you didn't see them in the Nordic countries, where you have a greater history of labour market participation amongst females.
Thanks very much. One of your initial slides showed the change over time in the active policies and the welfare benefit. Did the analysis look at that over time to see what the impact on employment is at various points in time, or is that?
No, I haven't done that yet. So your suggestion is this, like, split it up into, say, 10-year periods or something?
Different. There's change over time. For example, Germany is going down in time. In Australia, there was that sudden spike. Would that have an impact on the results?
Yeah, so I can exclude that sudden spike. I've done that because obviously it
looked like an artifact.
Yeah, so I have, but it doesn't really change much. I mean, you've got so much data here. Almost 20 years of data with, you know, about 50,000 people in each country every year. There's loads and loads of data points. It's actually quite hard for much to shift it, particularly when it's at the country level like that. So I'll do that though. I'll try and find periods, because particularly in Germany it was four periods of reform that were going on, but they were all about making the welfare state smaller. They were all really making it smaller. So I can maybe take those 4 periods of their reforms and do something with that. That's a good suggestion. Thank you.
Just wondered, what sort of thing is active measures? Passive measures and so on?
Yeah, so active measures are all sorts of things, like lifelong learning programs. That is an active measure. So if you're taking someone, say an oil worker in Aberdeen, and trying to give them the skills to work in renewables, and there's a government program to do that, that's one active labour market policy. If you then gave that person a job with a job guarantee and things that's underpinned by the government, which doesn't necessarily happen after lifelong learning programs, but it happens in youth unemployment schemes. So there was a Scottish youth guarantee where they were going to give people they give young people a 2-year employment placement along with training, so that there's some transferable skills if they don't remain in that job, and then some chance of career progression. So it's these training schemes a lot of the time. The difficulty with them is getting people to sign up, because people fear losing their existing benefits because of that. There's another question.
We've got time for one more.
Sorry, I wish David Walsh was here, because I'm sure he would ask. I'm reading his book at the moment about social murder, about austerity and austerity. I was wondering if you were able to adjust for other policies that would contribute and have an impact on health.
Well, I can adjust for them so long as the OECD collects data on them. And that's one of the challenges. That was another challenge with the Russian data, actually, because they didn't have, the OECD don't necessarily have data on Russian welfare state spending. So where there's a continuous series of data available that's comparable across the countries over the 20-year period, then yes, but that's quite high demands already. So I'm often relying on OECD data. And you know, maybe there might be some World Bank stuff that the OECD doesn't have, but it's actually very tricky to have a continuous series over a 20-year period, even in one country, let alone across 6. So I mean, this is all, you know, the last point about expenditure data is still challenging to work with. Even if you create this cross-country file, it still applies to that point. But if you know of any, I'm happy to give it a go. Yeah.
Thanks, Daniel.
Thanks.
Next up, we've got Amanda.
Thanks. Hello, everyone. I'm really happy to come and speak to you today about a study that I'm working on. It's Assist Global, so that's a Stop Smoking in Schools Prevention Intervention. And I'm speaking to you today about the Indonesian part of the findings. This actually took place in both the Philippines and Indonesia, but I'll be presenting the qualitative results. Some of the other team members are here in the room and also online. So depending on anything you want to ask, they may be better placed to answer those things. Got a lovely quote there as well from one of the peer supporters about how the intervention made them. So I'm going to make this quite brief so we've got enough time for other things. As we know, smoking is a really big problem globally, but most of the world's smokers live in low to middle income countries. Indonesia and the Philippines are two of those such countries. So we wanted to choose countries that did have high smoking rates, where we then might be able to make a difference in terms of the intervention. So as you can see there, adults in Indonesia is pretty high. We've got 65% of men smoking, but really, really low for women, so just over 3% there. And then with young people, our intervention is all about young people. So their smoking rates between 10 and 18, just over 14% of boys and a tiny, tiny amount of girls. This is due to a social taboo about smoking in these countries that's driving that. SIST is a peer-led intervention model. So what happens is students actually nominate other students that they think are influential, trustworthy, respected, and so on, to get special training about how to spread anti-smoking messages amongst their peers. So it's already been successful here in the UK. There was a large RCT that was done, shown to be effective, and we really wanted to see whether this could be taken to these other countries and whether it be effective as well here. Study design, it's a mixed methods feasibility trial with an embedded process and economic evaluation, 10 schools per country, 6 intervention and 4 control. Big set of methods as well, qualitative and quantitative. The qualitative that I'm speaking to you about today is focus groups, also interviews. There are quantitative questionnaires, baseline and follow-up, process questionnaires, so peer nomination questionnaires, and social network analysis to understand the spread and reach of the intervention. There's 5 participant groups, peer supporters, non-peer supporters, parents of peer supporters, trainers, and teachers as well. Big qualitative data set. As you can see there, it's sort of 343 participants across Indonesia and Philippines, 186 in Indonesia. Okay, so now moving on to some different things I'm going to tell you about in terms of our findings today. Being nominated, who was nominated, and what were their reactions to that? So were the correct students nominated and identified by this process? So overall, the participants did agree that the right people were chosen, but there were some differences in opinion on that. Some people thought maybe we might miss the quieter students and their friendship groups. They might be missed out of that, and they might be perceived as more trustworthy. A kind of slightly thorny or knotty issue that comes up in this study as well is the idea of smokers and should smokers be peer supporters or not. People have different views on that. Some people say yes, they've got lived experience, this is fantastic, that's good, they should be peer supporters. Other people are like, well no, this doesn't make sense to me. So we can see a quote there, sure, they are not suitable because many of those who got selected are also still smoking, and some more boisterous students as well were seen by some people as not suitable. Peer supporter reactions, this is a really lovely thing about this intervention, is it actually made the peer supporters feel really good about themselves. By and large, they were surprised, they felt seen, they were excited to be peer supporters. And here we have the quote that I put as the title of this presentation. At first, I was surprised, how come I was chosen? Then my friend told me about the reasons why and such. So yeah, I felt happy. There was something like a sense of being trusted and acknowledged. I felt like I existed, which I just think really sums that up in a really lovely way. So what about the parents and the non-peer supporters? Parents mainly were happy about their child being in this programme. They thought that it's going to give them life skills and give them a broader education than just their school education as well. Here we've got a stat from quantitative research. Just over 78% of peer supporters said their parents or carer were happy about them being a peer supporter. Non-peer supporters also thought that the intervention was valuable as well, and that there was a problem with smoking in Indonesia, including with adolescents. And you can see the quote there, because it's really important, especially in Indonesia, where there are many smokers, especially teenagers. There must be many who smoke. The fact that the nomination process is peer-driven as well is really, really important here. And a lot of people mentioned that as a significant thing, because they commented if teachers are selecting the students, well, it's going to just be the usual suspects and the favourites. So peer-led, peer-nominated, super important. Moving to the peer supporter role and implementation, I'll talk to you about some facilitators to this, barriers, training, and role readiness. There's lots, so I'm just going to zero in on a few things for you here. So here are the facilitators first. Peer supporters said some of the incentives that they received were really valuable to them. They got little toys, certificates, pocket money. The training quality was also commented on a lot as well. The trainers were really, really praised as being really excellent. Something in the training was also about the ingredients of cigarettes. This seemed to make a huge impact on people. They didn't know what was in cigarettes, and they found that really fascinating and quite horrible, actually. Something that was also a facilitator was initial practice with family members, and I'll talk a little bit more about that under barriers. Interestingly, in our world where adolescents are driven by social media, we would think, they actually said what they really valued was face-to-face conversations with their peers, and they thought that was more impactful than posting something online. So that's a really interesting finding and facilitator we had. And as we would expect, so the peer supporters are supposed to talk to their friends about not smoking, and having a close pre-existing relationship there really drives that conversation as being more successful. Non-peer supporters, again echoing about the close personal pre-existing friendships, and the in-person conversations comes out there as well. If the non-peer supporters generally has a positive stance to not smoking, that's important too. Okay, also that the prevalence idea coming in there. Barriers, let's move on to them. So peer supporters and non-peer supporters, again, just I'm going to talk to you about some. Something that came out quite strongly was a lot of these peer supporters were quite high flyers that were nominated. So they were actually quite worried about missing some of their school lessons by having to be out of their school studies to attend the assist training. So there's something around that we need to think about. Scheduling conflicts as well. There was things like sometimes if an exam was coming up soon, if there was class tests. Ramadan in Indonesia as well, where people need to fast and smoking is prohibited, was a barrier that happened as well. So during Ramadan, people don't smoke because smoking can break the fast, so we don't remind each other. So there's this kind of unnaturalness about talking about smoking during Ramadan, as well as peer supporters feeling quite exhausted, tired, hungry, and so on. And, you know, assist conversations was something else that was challenging for them to do on top of that. Although the initial training was pointed at as being really, really good, there's something around the follow-up training that maybe didn't occur quite in the way that people would have liked it to, maybe as soon as they might have liked it to, or as often. So they didn't maybe feel quite as prepared as they could have done, and that's something that we need to take forward as well. Non-peer supporters, there's something about the sense of slight skepticism that some of the non-peer supporters had about particular peer supporters. They felt that they weren't maybe quite able to perform their role as well if they were a smoker, and not credible or trustworthy in this way that I was mentioning before. And just some that they just didn't think were performing the role particularly well. They didn't think they had the nous, the information, the knowledge to be persuasive. And then the asynchronous learning, so there was some school holidays, it moved on to asynchronous learning. that opportunity for the face-to-face conversations when, and as I identified to you earlier, that was something that was really significant and important. So now what about the impact, the personal growth for the peer supporters and the wider impacts on other people? Peer supporters said that actually something that really happened was it increased their confidence. They felt like they were better at public speaking. And something like Assist in this type of intervention, it can do a lot of capacity building. It can really improve things within the person as well as externally outside to the non-peer supporters. So you can see there, it made us more confident, sharpened our public speaking, learned to respect each other's opinions. There was also a ramification of relationship building. So some peer supporters who hadn't known other peer supporters, when they were getting trained together, that actually enhanced and fostered their peer relationships. So that was another really kind of nice impact with a kind of peer supporter community forming. In terms of peer supporter influence on other smoking-related impact, there was an increased awareness of smoking harms. Some people even stopped smoking, although that's not the actual aim of Assist. Obviously, that's a good outcome, but we're all about prevention. Visible smoking around schools temporarily reduced. Some teachers said that they noticed that some of the kids who used to smoke near the school weren't doing that anymore. So that's a really good finding as well. And so here we have a quote. I have explained the ingredients in cigarettes. He was indeed smoking, so I gave him the website. He kept it, he understood that. Now he doesn't smoke anymore. So that's from a peer supporter. Something I mentioned to you earlier about the messages going out to family members as well. This is something that's really quite good because it's not just the non-peer supporters that are having conversations with the peer supporters, they're also talking to their families as well. So it can help parents think about reducing or ceasing smoking, or siblings as well. And that was something that we found happened. 48% of non-regular smokers who reported having tried smoking at baseline said they found the intervention useful. That's from the quantitative results. Other impacts, peer supporter behaviour. So some people did just actually continue smoking, so that affected their credibility in the eyes of the non-peer supporters. As I hinted at and mentioned earlier, negative or unintended impacts, missed lessons, fatigue, the additional burden of doing the Assist training, being a peer supporter, but thinking about that as balanced with benefits as well that we saw. External complaint from cigarette stall. One of the cigarette stalls that's near one of the Indonesian schools that we had Assist at said that their sales had gone down. I think this is a positive thing. I'm sure you agree to. Other factors, punitive school policies felt by some to have more direct impacts. So some of the things that happen in the schools is they'll get these like school bag raids to see if they've got any cigarettes in their bags. Also, there's like point systems as well where they can get points deducted if they smoke. Some of the non-peer supporters said they thought those measures are more successful than Assist, but again, that's a minority view. But teacher and parents' involvement is really crucial for sustained behaviour change. Okay, so I need to wrap up now, but just to say we had lots of lessons that we learned as well, and we will address the various things that I was pointing to, but we're sort of grappling with weighing it all up. I'm looking at Sharon here because we are in the midst of that. We've got decisions to make. Okay, thanks very much, everyone.
Anyone have any questions?
We've been banging on today, but thank you very much. That sounds like an amazing program of work. But I was interested in the male-female differences, and I've read before that in Indonesia there's a sort of coming-of-age ritual for boys or men, boys transitioning to adulthood. Did you notice differences between male peer support workers, boys or girls?
It was something we thought about quite a bit before, and Sharon can maybe come in on well if there's anything I don't see. We sort of grappled actually with whether girls should even be peer supporters if more boys are actually the ones who smoke, but then we thought, well, girls can influence boys as well. So that was useful. But one of the things that was said was that in terms of the non-peer supporters' reactions, some of the students said that male non-peer supporters were a bit more boisterous, a bit more kind of mocking in the way that they might respond to some of the peer supporters. So that was one gender difference there. Sharon, do you think there's anything else that you'd like to add on that?
There's something I can't remember the Indonesian or Philippines data about the girls being more effective communicating the messages than the boys were. The boys were just like, the message out, but the girls were trying to think through how it might apply to that actual person. But I can't remember which country. I mean, we were very keen to include girls because girls are very so, girls is way lower if they want to include the girls, and also people say what the real rate of smoking is in these countries, because clearly it's really culturally unacceptable for women to smoke. So the reporting rates, whether they are actually smoking, are potentially very much underestimated.
And assist, it was all about smoking before, but now it's starting to have more on vaping, and probably going forward we'll be thinking about including more on that. And girls are vaping a bit in both these countries, just not saying that they're smoking as social taboos potentially.
What really if they're associated with masculinity or machismo, would boys listen to boys more than girls? I'm not really if that's the thing. This person's like.
Yeah. So with assist, the peer supporters are only supposed to speak to their friends about smoking prevention. So you would think that, and our thinking was that the girls would still be influential on their male friends and listen to them. But there's something really around definitely masculinity in Indonesia being tied up with smoking, it being seen as a kind of male rite de passage. And also there's things around even in religious ceremonies, sometimes cigarettes are given as gifts to young males at the ceremony. So there's a lot of interesting stuff there.
Got a question that came through in the chat.
Yeah.
Were faith-related conversations stimulated in light of Ramadan coming up, having passed, even though smoking was not?
Faith-related conversations. Could ask George a little bit more about what you mean by that, George? Faith-related conversations. Do you mean about smoking?
Yeah, I suppose if so during Ramadan you said that smoking wasn't permitted, but I wondered if faith was maybe an element of motivation or had relevance to people in considering smoking at times when they were more willing to discuss it, even if it wasn't a talking point during Ramadan.
Don't think that's something we've got any data on, actually. I've not seen anything on that.
I'm not actually clear on the question. Sorry, I'm probably being dull. Do you mean that because during Ramadan we were less likely or more likely to be to read that?
Or so I think what you were saying is, did people talk about the relationship between their faith and their smoking behaviours at all with the peer supporters outside of Ramadan? Was that what you were asking? Oh, we've lost George.
Right, that's a good question, because I think that I mean, I can't remember exactly what we said, but we have had a discussion with the Indonesian team about this. About whether smoking is generally discouraged. I can't remember what the actual
There's mixed messages, definitely in Indonesia, is what one of our Indonesian colleagues was saying. Some religious leaders say, don't smoke. Others are like, positive about it. So there's not one unified perspective.
Great, thanks, Amanda.
Thank you.
Sorry. I'll be sharing with you our findings from our Microsimulation work on the effects of universal credit on mental health. This is part of a project that we have been doing for a few years, just probably a second, in collaboration with a number of other universities, looking at investigating the mental health impacts of universal credit using several methods in several ways. I'll tell you more about that in a wee second. To give a bit of an overview of the rollout of universal credit, the universal credit was a benefit reform that was to replace 6 so-called legacy benefits, as to in many ways simplify the application process. So rather than applying for DWP for one benefit, HMRC for another, and your council for your housing benefit, universal credit was to bring it all into one application under the control of DWP. Altogether, it brought job seekers allowance, working tax credit, child tax credit, income support, employment support allowance, and housing benefit. The rollout, universal credit was rolled out in several phases throughout the first years of its implementation. There was a restricted rollout, which is partly a pilot phase from 2013 onwards. A main part of it was a natural migration phase where one by one each job centre took on universal credit as the default for any new claimants, any claimants changing circumstances, and that took place from 2015 to 2018. And now we're in the stages of a managed migration process, which has been on the go since 2020, where all claimants of all benefits are being managed into the new universal credit claimant system. There's a map of the universal credit natural migration, the main phase that brought most current universal credit claimants onto the new benefit. And this was rolled out in different months throughout the years 2015 to 2018, which gives us a lot of scope for testing the differences in effects at different points of time. There's several potential harmful effects of universal credit. For example, I've gone in the wrong order. Increased psychological distress. Early studies have found of people who moved on to the universal credit early on in the process. And also decreased quality of life and well-being measures. And these are some papers we produced as part of this project. People coming on to universal credit compared to legacy benefits. There's evidence of vulnerable groups who are entering unemployment having greater negative effects under universal credit than other benefits. More qualitative work has looked at the potential effects of the new claim system, feeling rather inhuman, not having personal contact with job coaches as often, and also delays in payments as people move from one benefit to the other, and other aspects of it that might be causing more stress and more strain on unemployed people. And these include extending conditionality and increase in the number of claimants who are unable to work due to health that we see under the universal credit system. Counter to this, there might, that's looking at the potential effect pathways from the Cheetah Mattel paper that might be working through into negative impacts of universal credit. Counter to all this, there's the proposal that one of the aims of universal credit was to increase the number of people entering into work by increasing conditionality on benefits claims, and that this in itself would produce an overall positive effect, as entering employment is known to improve mental health and stopping the exit from unemployment, as we saw earlier on, should also stop some of the negative effects of that. So in this project, we looked to test some of those things across 5 work packages. We're coming to the end of this project and are finishing updated and reported due in January. In work package 1, we're earlier on evaluating some of the effects using natural experiment models across that rollout period to give estimates of the effect size of universal credit compared to legacy benefits. And in this work package, in the microsimulation part, we'll be presenting some of how we use those effect estimates and those causal models to build a microsimulation model which can look at future impacts of universal credit and also potential changes to the universal credit system. From our earlier work, we proposed that this is a suitable causal way of understanding how universal credit may affect mental health through several pathways. First of all, if universal credit is having an effect on employment, there can be an effect on employment, but an effect that goes through employment onto mental health. People are encouraged into work or stopped from exiting work. Universal credit also would affect directly in income as award amounts change onto a new benefit. And alongside all of this, there'd be a proposed direct effect of universal credit on mental health, which we use to sum up all of the lived experience of starting a new claim, going through the claims process, going through the conditionality and sanctions process also. So anything that's not going through employment and income, we're counting as a direct effect here. We're using microsimulation as a tool for assessing this policy impact. And there's a brief overview of the 2 tools we're using for this. We're using Euromod, and the UK mod part of that is a static tax benefit microsimulation model that can apply real-world policies to a simulated population to give estimates of household income, estimates of benefit income, and estimates of population level spending on these things. We're also using SimPaths as a dynamic microsimulation model, which can process simulated individuals through several years and apply some of these tax benefit changes that we can simulate in UK mod to give differing yearly amounts of award amount and estimate the effectiveness that might have on employment and health. This is the SimPaths model. You can't quite see it. Just to give the brief overview, this is each cycle of the year that a person goes through. They'll go through each of these modules, which updates their status for that year, looking at the causal effects of what are proposed causal effects of what comes before in that year and what their lag status would be in terms of health, education, employment, and their income. The mental health module was already part of SimPaths, but we wanted to come in and add to that. And the key things we wanted to add were the universal credit effects, first of all, on labour supply, as a person chooses whether to go into employment or not, may be affected by universal credit. Benefit recipiency, calculated directly with the UK mod, and then the direct effects of universal credit on mental health through the mental health module. We did this through broadly 3 mechanisms which correspond to that one before. We simulated the employment effects through estimating the utility of differing labour supply choices under universal credit and not universal credit. We modelled the income effects through the UK mod of different UC policies and award amounts. And in the third case, we estimated the direct effects of universal credit, not through employment or income. The outcomes we added into the model were the SF12 MCS and PCS scores, the GHQ 36 score, and the caseness measure of that, all these 4 from UK HLS, and then the life satisfaction score that we estimated in difference models from the annual population survey. These were used to calculate also EQ5D scores for calculating QALYs, and the life satisfaction score we used for calculating Wellbeing. I know you're all experts on that, I don't have to explain them again. Great. We wanted to test 3 starting scenarios for this: a universal credit full rollout as is, so modelling each of those 3 pathways that universal credit may affect health. Then we wanted to model a universal credit with no direct effect, which could be a theorized model of if reforms were able to take away some of those stressors that people were experiencing that seem to be the reported main cause of mental health harms, but while keeping some of the proposed employment benefits of it. And third of all, a very more realistic model that if the employment enhancing effects and the mental health damaging effects go hand in hand, what a model would look like if all of those were removed and going back to the legacy benefit circumstance. So these are some of the preliminary results. We're still looking at model validation and making sure all the structures within it are working as we expect them to be. And we'll present these and we'll talk about what the final things to do are before the full models are coming out soon, hopefully. First of all, looking at the two scenarios for effects on employment, we looked at universal credit as is, and then also universal credit removing both the effects on employment and the direct effects. So the most pessimistic model that can only take out all parts that both damage health and improve employment, to test first of all whether this did have any legacy still benefits on or any effects on the employment that would be lost if these things are removed. And there does appear to be in the initial years of simulating up until about 2025, some evidence of that as a proposed improved employment effect, as the utility scores for universal credit labour supply choices were lower than for higher hours worked and not under universal credit. So people were prompted to try and find more work to not have to be on universal credit, it seems. But this does seem to be lost a little bit in later years and maybe overwhelmed by other effects. Similarly, looking across age groups, there seems to be that similarity of effect, that universal credit does seem to have some effect on employment, but in some age groups, 25 to 34 and 35 to 49, seems to be less evident there. So looking at then how that would work when it comes to mental health, so this is trying to combine both the probable positive effects of entering employment with the observed negative effects of being on universal credit. And across the three models, you see there's very little difference whether the employment effect is there or not, because as we saw, the gap between the employment effects of these two doesn't differ much. But if we add in the difference between the direct effects switched on and off, this does seem to project quite a significant drop in mental health across this time, or an increase in mental health GHQ psychological distress score across the whole period. Similarly, this is across ages, although the younger age group doesn't seem to experience as strong effects as some of the older age groups do. And then looking at household structure, a similarity of pattern, whether they're partnered or single, whether they have children and no children. Those who are single with children in other studies seem to be the most vulnerable to change in universal credit. We seem to have the widest, the narrowest gaps between effect compared to the uncertainty intervals. And similarly, looking at life satisfaction by gender, there's an accumulating drop in life satisfaction across the years, similarly across age. Finish up in just a minute. Yeah, great. So looking at then changes in quality adjusted life years across this period, there's going to be again an accumulating effect of loss of QALYs, which by calculations by 2035 is summing to about £22 billion worth of lost QALYs per year. And similarly with Wellbees, amazingly, they seem to line up. This is accumulating to about £20 billion worth of lost Wellbees by year, which is strange. I didn't expect them to be in the same ballpark, but there you go. We'll have some final planned analyses. One of the key things we want to do is look at the difference in award amounts, what that might change about the effect size. Although from those graphs, it does seem to be that a lot of the effect is in that direct effect part, and perhaps that points the direction to better reforms that look at the direct effect, even if it has removed some of the employment effect, as being better for mental health. And similarly, this is the hypothesized change of conditionality, which might reduce both of these causal pathways. But that's kind of our summary of results. These do seem to appear consistent. The observed with the universal credit as is consistent with the observed changes in mental health across the 2015 to 2025 period. And a few kind of final stages of aligning of employment to make sure that looks like that it is following an observed status, and alignment of the number of people claiming universal credit, and that should hopefully give us a more trusted model. And thank you, Rach. I'll pause there. Thank you.
Time for a couple of questions.
Interesting. I see that you mentioned the you over EQ50, so that there would be the quality some quality measure it would be you're capturing, and then you talk about the economy corporation you're going to do later on. Where did costs coming from? And you're considering the source of the cost?
Yeah, it's the cost modelled here is that the cost to quality adjusted life year, and the difference between a universal credit with none of the UC specific health effects versus with the observed one. So that was looking at two models of a universal credit was simulated with the legacy benefit, lower damaged mental health effects rather than the new one. So it's kind of clarify that would be specific hypothesizing if we were able to reform it to remove all of the prior harms that we've seen. That would be the change in cost.
Okay, so that's substantially.
Yeah.
Okay.
Yeah, and this to cover this is across the 200,000 working age adults that we simulated. This is the total difference in quality adjusted life year, and scaling that up to the estimated expected 8 million households that are expected to claim universal credit by the time the fully rollout period comes. That would be the full cost across all those households.
I just wanted to put something more in terms of cost associated impact.
Yes. Oh, yeah. There's going to be some of the analyses that are coming out of Work Package 5 will look at particularly the fiscal costs of.
So it might be more helpful to think of this as the valuation of adverse health impacts, as it were. It's not financial.
Yeah.
Just a couple of slides earlier.
That one?
Yeah. In this set of slides, the orange one is very different from the green. So what is the orange one?
Yes, the orange one is the current structure of universal credit and effects as observed still applied to the population. And the blue and the green are if we remove either or both of the direct effect and the effect on employment. So if we remove the direct effect, keep the positive employment effect, that's the blue line. If we remove the positive employment effect, also the green line does seem to show a slight lessening of life satisfaction as less people are prompted to enter employment. It doesn't bring it down anywhere near as far as the additional negative direct effect. So it seems to be showing that direct arrow is overwhelming the whole model compared to balance up with positive effects. And well, the income differences aren't quite modeled in here, but the qualitative evidence seems to indicate that the change in income was less. The sort of shock period as people were entering it, but the overall calculation of different income, quite a small effect on it.
Unfortunately, that's all we've got time for. But thanks again to all of our speakers today.
Yep.
The next cross-team seminar is on the 2nd of December. Thanks, everyone. Thanks, everyone online.